I get asked a lot about back pain. No, it's a very prevalent condition nowadays. Why? Because we spend a lot of time sitting down. Yeah, I mean, basically we're very sedentary, and that has created a lot of problems. We're also living longer, so this has arise a huge issue with back pain. The good news is that not necessarily if you have back pain, that means that you're going to have surgery or need surgery or that you need anything invasive. Normally, what we see the most is that pain is usually related to either inflammation of the joints or something muscle related or tendon related. How do we determine that? A lot of times it's going to a doctor and seeing and getting an evaluation or a physical therapist and seeing, okay, where is this pain coming from? When we talk about the joints, a lot of times it's with extension. So you're sitting and you're getting up and you feel a lot of pain, a lot of dull, achy, throbbing pain in the back. This can be troublesome. I get a lot of housewives or a lot of patients that did a lot of garden work, for example, or they were doing the dishes after a weekend and they feel this pain. It's a localized pain. It doesn't move anywhere. Usually when this happens, a lot of times, again, it's coming from the joints. Why? Why is it coming from the joints? Because the muscles around the spine basically are weak. And this happens to all of us as we age. We start losing muscle composition. The muscles are not the same as when we were 15, unfortunately. And if we don't work those muscles on a constant basis, meaning every day doing stretches, maintaining that integrity of those muscles, they start losing that capacity to hold weight. And all that weight is transmitted to the joints. So we start getting inflammation of the joints. And this is fairly common. I see it in patients in their late 30s, I want to say, 40s, and then it becomes chronic. The problem is that these recurrent bouts of inflammation, I have back pain, I took some anti-inflammatories, it gets better. But if you don't do the strengthening part, this recurrent inflammation is going to lead to arthritis. And once we have arthritis in these joints, then, it's game over. This is going to be a source of chronic pain. And at that time, then you need other procedures. At the Institute, we do a lot of things related to regenerative medicine, so stem cells or platelet-rich plasma or some sort of natural anti-inflammatories, or in conjunction with physical therapy. We have very good physical therapy protocols, and we work with therapies. So the idea is always to use the most natural approach to give you a long-lasting relief and to teach you about your condition so that you can treat it and cure it. That's always going to be the approach. So in back pain, again, there's many reasons. Now, there's other sources of pain that are maybe a little bit more complicated, especially if you have herniated discs, sciatica type of pain, all these other things that are more related to more advanced conditions. And that's going to need some sort of different intervention or treatment option. But the whole point of this conversation that we're having right now is that you don't have to live in pain. I mean, there's many options before surgery. And just find the right approach, something that works for you, and ultimately that is going to give you relief, and you're going to live a happy, long-lasting life.